Well, I'm currently participating. It's called a Visiting Nurse Faculty Program. It's sponsored by the Edmund J. Saffer Foundation, and then it's sponsored by, or taking place at the Struthers Parkinsonian Center in Golden Valley, Minnesota. The program started out with a very intense 2-day, basically didactic classroom session on everything you needed to know about Parkinson's disease, but we're afraid to ask. It was actually excellent. Um, this Struthers Parkinson Center has a multidisciplinary approach, and while that's become extremely fashionable in the past few years, they've actually been doing this multidisciplinary approach for caring for patients with Parkinson's since the 1970s. And so in that 2 days, we heard from each member of the team. It was very informative. One of the things that really struck me was the research that's being done in terms of exercise and how it can actually delay progression of Parkinson's disease. And I found that very exciting to know that there's one other diagnosis, that exercise is like the ultimate in therapy for that disease. Also, as part of that project, I spent a day with Dr. Tanya Harlow, who is a neurologist at Sanford Clinic here in Fargo, and they also have the multidisciplinary approach in their coordinated treatment clinic, which occurs once a month. So that was a very interesting day too, to see what's being done in our geographical area. In the next several months, what I'm going to be doing is I'm going to be developing a learning activity. And of course, because I teach online, it'll be an online learning activity. But the goal of my project is going to be to increase the awareness of nurses that care for Parkinson's disease patients. One of the things I'm going to look at is the importance of meds on time, which is huge when the patients that have Parkinson's disease take the dopamine medications and also the dopamine agonists, that they get them on time. And that's very, very important in terms of their function, particularly when they're admitted to the hospital. We're also going to be looking at the neurological assessment and also some of the autonomic symptoms that are associated with that diagnosis. The other passion that I have currently is the transitional care process. When I worked in a long-term care setting, I became so frustrated with sometimes the lack of communication between different healthcare settings as a patient moved from place to place to place, which is very typical of the elderly. They're at home, and they go to the hospital, and they go to the nursing home, and then they go home, and community health might be involved. And I really think that the readmission rates, of course, have been demonstrated to be affected by the transitional care process. So that's kind of my other passion. Well, what my plan is then to incorporate that element into this learning project that I'm doing for Parkinson's disease, because certainly the transitional care process is extremely important for the success of patients with this diagnosis.